You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
The Respiratory Innovation Summit will be here before you know it. It was held in San Francisco this year, and it's coming up in Orlando, not too far from now. And our deadline to apply to speak is February 13th. Joining us is an innovator, founder, CEO of Samay, who presented her technology at RIS, at ATS conferences in San Francisco, Dr. Maria Artunduaga. Welcome.
Perfectly pronounced. Hi, Patti. Thank you for having me.
And your story begins in a very small town in Colombia, not Bogota, but very small town, where your parents both were physicians. And you were surrounded, you said, by women who were very, very strong women and movers and shakers, including your mom, who's a surgeon.
Yeah, absolutely. My story began in Colombia. It's a rural town of 300,000 people, a lot of strong-willed women in my family, and I was the daughter of two physicians, and that really shaped, but what really shaped me was the story of my little sister with cerebral palsy. Seeing her struggling, watching how she couldn't do a lot of things, especially moving around, it was something that really I struggled with. So part of the story into my journey to medicine starts with her. I was heavily motivated to get into medicine. Obviously, the fact that I come from a family of physicians, but what I witnessed firsthand with her life, I wanted to fix things to heal, and that's why I originally wanted to become a surgeon. I spent some time during my medical school doing rotation at a military hospital in Colombia, seeing trauma, seeing what surgery I could actually do. And then I came to the US to spend the last year of my medical school here in the US. During one of those rotations, I got a contact that led to an unpaid position at one of Harvard's most prestigious genetics research labs. But it was an incredible opportunity, of course, but I had nothing. They wouldn't pay me for the first year, so I had to go back to Colombia, and I worked for a few years to save $30,000. I remember the exact amount precisely, and until I had enough money to support myself and eventually go back to Boston, where I spent about 4 years doing research. And that sacrifice, that hard work taught me, a lot of things. Something, especially, something simple and brutal. When you have to get something to happen, you have to really work extra hard, and there is not a shortcut. And that's exactly what I do actually every day at Samay. I hustle a lot.
Right. And you ended up in Chicago and wanting to be a plastic surgeon, but the cards didn't play out the way you had hoped. But in the long run, they did. And must have been very frightening and disappointing that you had to switch gear to public health.
Yeah, I was unlucky. I experienced discrimination and unequal treatment during my surgical residency. I complained about it, and instead my program director, instead of addressing that issue that was probably 13, 14 years ago, he actually terminated my contract because I became a nuisance, and just, too annoying for him to manage for speaking up. It's a really interesting story because even before finishing my rotations, there is an interesting anecdote. He sent me home to do handwritten summaries of a 500-page plastic surgery book as a punishment, as a lesson, because I was rocking the boat. It was a very traumatizing experience. And I decided to leave clinical medicine for good because of that. Unfortunately, that a nightmare that I had to go through.
Yeah.
But at the same time, that moment broke something also in me, but not in the way that probably he had intended. It made me really realize that, no amount of publications or credentials protects women of color from the developed countries from systemic inequality anyway. And it made me angry. So that's why I refer to this thing of leaving medicine behind, because what I decided to do was to, create something for my own. And I decided to get into public health, because that was the other thing that it really was one of my passions, especially because I come from a rural setting in Colombia, and I saw a lot of inequalities in the rural place where I was living, and obviously by the fact that my parents were physicians and they had a hospital where they manage a lot of people, so I experienced firsthand a lot of the things that uh, people from low socioeconomic status have to go through and live every single day.
They say life is a journey, not a destination. So dots eventually connected.
Yeah,
And
they did.
how did Samay come about?
Wow, the idea, the concept of Samay, it was actually pretty interesting. It most people actually compare it to a continuous glucose monitoring sensor. The concept came from a specific moment. I call it my eureka flash. And I was visiting a pulmonologist at the Veteran Affairs Hospital probably 7 years ago, and he was studying for the past decade or so and how the lungs sound different when air gets trapped inside and when the disease progresses. And what I realized at that moment was that sound is data, right? And the resonance of the lungs tells a story. So what I thought was, if somebody with COPD, for example, obstructive disease, which was, by the way, the disease that killed my grandmother and the reason why I started doing all of these interviews with pulmonologists at the time. So what I thought was, if patients with COPD start developing or trap their within their lungs when they are declining or when they are having more exacerbations, you could probably use an acoustic signature of the sorts, probably the resonance of the lung, to figure out what's going on inside. And that's the moment when everything clicked. And there is a device that is called spirometry. That's the one that's been existed for 170 years so far, but it hasn't really been innovated in a way that it's the same technology. And I just thought, maybe a different approach could change a lot of things for everybody, especially using something as portable as this and that you can place on your chest, send signals through the chest. And we use very sophisticated mathematics. So the bytes and the softwares that, we're using every day on computers. And maybe if we have this new original idea, we could do the same thing, probably lung function anywhere you go. And especially coming back to this comparison with the continuous glucose monitoring sensors, the idea of Samay is to eventually become the Dexcom for respiratory. So a company that is building patches that you place on your chest for 2 weeks in a row, and you get your numbers every single day.
So it's akin to what diabetics use to monitor sugar?
Yes, exactly. So Dexcom is a company that builds the devices. There is obviously Abbott, and everybody knows about them. So they put them on either, their arms or their abdomens. In the case, of course, of respiratory diseases, you have to be on the chest anyway. So that's the main idea. We have 17 granted patents so far, and about 15 more pending all over the world, not only the US. We have patents in China, in Chile, in Israel, even in Canada, Europe, Korea, Japan, Australia, you name it. So yeah, we have a lot of patents, which is obviously very, very good.
So your family actually led you, not only your younger sister, that led you to want to do, plastic surgery, and then you switched gear and found something because your grandmother, it was a homage to her, and your husband also is an MIT engineer in acoustics.
Yes.
That helped to develop the product, correct?
So the original idea when I left medicine, and I did this master's of public health, I decided to go into another master's degree at Berkeley for technology development. And I was taking a class, a business class, where I had to complete 100 customer interviews. That's how they call it. They're literally just qualitative research. You have to go out of the building or the school at the time, and you have to interview a lot of people. And that's how everything relates to the interview that I was mentioning about with this pulmonologist, when he was explaining his research about air trapping. My grandmother had died from COPD a few years before that interview, and I wanted to understand why she had passed in Colombia. What I had thought at the time was that, maybe we are just living in a developing country and we don't have the right technologies to monitor people. when they are outside of a hospital,
Mhm.
we still rely on patients to tell us how they feel. So either the symptoms, I'm coughing more, I'm short of breath, I cannot climb the stairs, I'm not sleeping well. And we're still relying on qualitative data to even actually diagnose the exacerbations of respiratory attacks. So 50% of the exacerbations go undetected and unmanaged everywhere, regardless if you're in Colombia or here in the US. Could be anywhere in the world. So I wanted to understand why that was happening. I did that interview with this pulmonologist, and I don't know, I guess the planets align in a way. I happen to be married to a guy who went to MIT, and he's an acoustics engineer, an electronics engineer by background as well. And he was working at Google. So he's one of the worldwide, leading engineers in all things acoustics. And we've been married for a long time, over 18 years, I think, that we have known each other. And he's always running experiments, audio experiments at home. And I don't know, at the time that I was describing with the eureka moment, I just thought, what if we use the same methodology, like, hearing aids, consumer devices, speakers and phones that come on, like, headphones, or maybe in consumer devices such as mobile phones, right? What if we send those signals through the chest, but using very affordable sensors? So I wasn't thinking about using expensive ultrasound sensors that if you just Google it, portable ultrasound is costing you probably $2,000, the little tiny ones. In my case, I wanted to really solve a problem that is killing most of the people overseas in the global south, especially in low and middle income countries. And that's when I thought, what if we use these speakers or microphones that you buy literally online? You put in a different form factor, like I call them, the Sylvie device is literally like a headphones for the chest right now. We are sending signals from the back to the front, and we are making the lung resonate as a musical instrument. And that's exactly what we are doing. We're using that resonance, the acoustic resonance signals, as the proxy or the foundation of everything that we do within Samay, which has a lot of course, AI, machine learning algorithms building, and digital signal processing, cleaning up everything. So yeah, I don't know, Patty. It was
A way to making a huge impact the way you wanted to.
I got lucky.
Right.
Early bird registration for ATS 2026 in Orlando is now open. Register now and save. Members get a discount, so become an ATS member or renew your membership to take advantage of the savings. Visit conference.thoracic.org today.
And so being an innovator, entrepreneur involves taking risks. And that is something that you impart on to other women, correct?
Yeah. Yeah, it's interesting because we as women, we're always told that we should definitely avoid risk and try to, go by the book, right? Like just follow the book, do the exact same things that everybody else is doing because it has been the risk and it's going to work out. But one of the things that I discovered, especially when I was left with nothing, when I was kicked out from my residency program and unemployed for 2 years, was that probably that wasn't the right way of, doing things, because not every time you follow the recipe or the protocol, actually things work out. And in my case, it did not. And I was always an A+ student. I was the best SAT in my in my state, one of the top 10 in my country. I had 1 billion scholarships on everything that I did academically. I was really, really good. I always excelled. But I think taking calculated risks is definitely worth it. And every time that a woman comes to me to ask me for advice, I always tell them, don't wait for permission. The real risk is a life unlived, but at the same time, you have to think of all of these plan B, C, and D if things don't work out, especially financially. So in our case, for example, for Samay, my husband, Ricardo, he helps me with a company, but he's still, working for big tech, and that works perfectly for all of us as a family. So I think it's the smart way of building a company, and it has worked well.
As a startup, so investment, you said you received a $50,000 grant from NSF, correct? And but it just, when it took grit because you just would not take no for an answer. And you tend to pursue things that are difficult rather than most people who say, they want to take the easy route.
Yeah, so I've been working on this company for 7 years. And yeah, just going back to what you were saying, people ask me constantly, Maria, why haven't you really gotten, an FDA clearance yet? You met me 7 years ago. Why is taking it so long? But so what people doesn't really get is that we are actually building a de novo technology. And what it means is that we are not building on an existing technology or a predicate, another device, right? We are creating something entirely new, and hence that's why we have 17 granted patents, and that requires training algorithms with thousands of patients, that requires building a wearable that is probably going to cost 3 to 5 million more to develop properly. And doing it under 2 years, if you want an American team, well, that's going to be quite expensive, especially in my case. What I had to do was, originally when I tried to raise money, obviously the idea sounded too crazy. We went through a lot of the literature, and like there were a few papers on using the principle of acoustic resonance to detect respiratory diseases. So obviously nobody really wanted to invest on something that could probably fail. And the reality is that medical technology companies struggle a lot because it's fundamentally different from biotechnology. With drugs, you can set your own price and you can control your margins. But with medtech, you have to fight for reimbursement codes.
How did speaking at RIS at ATS in San Francisco, how did that validate you?
Oh my gosh. After ATS, there is a really nice story about the Respiratory Innovation Summit. Something truly unexpected happened to me. There was a doctor that published a paper. His name is Dr. I don't even know if I'm saying it correctly in the German way. Dr. Jens Holfold. He works at the Fraunhofer Institute of Technology in Hanover. And he had published a paper on air trapping detection and COPD diagnosis using low frequency sound. So mainly the same principle that we were using. And I never reached out to him ever before. And during my presentation, right after I finished, he came to me and he told me, hey, by the way, I'm the doctor who actually wrote that paper. I'm the senior author. I would have never, ever expected my research to actually inspire a technology that is currently being, developed for an actual, to help people, right? So he had no idea that I even existed. So that moment was truly inspirational. We even took a picture and everything. I was so excited about that. I didn't expect him to be there. And obviously he didn't even know that about me either. So yeah, the moment was sort of like surreal. A leading European scientist realizing that his foundational work is now becoming a product that could reach millions is amazing. And also, the Respiratory Innovation Summit has been helping in many, many other ways. It opened a lot of the other doors. For example, we are right now finishing up a couple partnerships with other startups. We are negotiating contracts. And NIH program director who saw the presentation is actually advising me now. And the most important thing, of course, is that Chiesi, a pharmaceutical company from Italy that I've been talking about a year, probably 6 months before the actual Respiratory Innovation Summit, when they saw the energy in the room, right? Like the pulmonologists, the scientists, sort of like very, very excited about what this wearable could do for democratization of respiratory diagnostics globally. It really validated us as a company, and they decided to go ahead and sign a pilot with us. So we signed in August, 3 months later, and we're extremely happy.
And you're expecting a huge announcement coming up.
Yeah, I mean, if with Chiesi, hopefully if everything works well, we are thinking of continuing the partnership. Obviously, everything depends. It's up to them. But so far, so well. The pilot's actually going very well, and all of our technical milestones have been.
That means $1 million.
I've been getting. Yeah. Sorry?
That's $1 million in investment?
I don't know. Maybe. I think it's too early to tell, but hopefully, yeah. I don't know. I mean, if we decide to move forward, that we will probably make an announcement sometime in the summer of 2026. We'll see. Fingers crossed.
Another designation that you achieved this year is top 100 female in Latin America.
Yeah, so I just found that I'm one of the top 100 women in technology. It's called Aurora Tech Awards worldwide. 3,000 women applied from 125 different countries, and I made it. One of 11 Colombian on the list and 9 Americans. I'm Colombian American. I have a citizenship here. And it means a lot because, I'm a woman from Latin America building deep technology here in the US in a space where most founders don't look like me, right? So I'm definitely an outlier everywhere I go here in Silicon Valley. So it means a lot.
So what advice would you give to other women teetering on starting something?
Oh, yeah. It's gonna be a little brutal. I would say be willing to be uncomfortable. When I left plastic surgery, especially my parents, they thought that I was crazy, that I should just get into another residency and that's it, because that's the right way of practicing medicine, right? And I had, these prestigious, specialty, clear path recognition, et cetera, but I decided to just walk away from everything. I just wanted to build something where I was proud of, that sort of like a legacy type of thing. And more importantly, where people around me were okay with having me as a Latina with an accent doing work, right? And I'm also pretty ambitious, pretty driven. So if I had 5 things to say, I would probably say, in my case, what has worked really is, listen to the problems that are very close to your heart. In my case, the fact that, my family members inspire a lot of the decisions that I've made in my life professionally. The other thing is, I'm not ashamed anymore of saying, or of having, for example, an accent or saying it out loud. I'm from Colombia. So every conversation that I have nowadays, especially with investors, like I have noticed, I have an accent. I'm from Colombia. Let me tell you about my country and my culture and like why I move these hands the way I do, right? So yeah, that's very interesting. And the other thing is like, surround yourself with believers. In the case of my husband, he's been great at supporting me and my company. And obviously be patient with the timeline.
What's a short-term and long-term goal that you have to make your mark? Just what you really wanted, and you said you always pursue things that are difficult rather than easy. So where do you see yourself?
I'm thinking more about the company nowadays, the technology, than myself anymore. I don't know if it comes with age. I'm 45 now, but I wish at least 1 million people have used the technology by 2030. That's my goal these days, either through a diagnostic product or a monitoring product of the sorts. I really want to impact a lot of lives instead of like, thinking as a surgeon who was doing a surgery every 4 hours, right? I really want to see that something that I invented is touching the lives of millions of people, because they can be helped in ways that right now they have no way of solving at all, right? I mean, we are still relying on people feeling how, telling us how they feel to make diagnosis of exacerbations or even itself COPD or asthma or any other chronic respiratory condition. So we have a true problem with diagnostics worldwide.
Dr. Maria, we love your energy and enthusiasm. And thank you for joining us today and hope to see you soon.
No, thank you so much for having me.
We'll wait for your book.
Yes. Give me 8 more years.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.